Hello there, my name is Glafkos Tombolis. I'm the principal dentist at Ethicare Dental. We're a private practice between Putney and Wandsworth, and it's our 10-year anniversary this year. So just as a kind of a little bit of a celebration for this, I just wanted to give you a guided tour of the practice, just to show you around a little bit. So we're a family-run practice, and we're just at the junction between the Upper Richmond Road and West Hill. We're about a 7-minute walk from East Putney Tube Station. We're not far away from Putney train station and Wandsworth Town train station. So just going into the practice. So we're family run. It's myself and my wife, Claudia. Just go in here. So as you come into the practice, you'll be greeted by our very friendly reception staff. Okay, at the moment, Svetlana's on duty, and so this is our reception area. You can see there's a TV, various dental products, water machine, and hopefully you won't be kept waiting too long before your dental appointment. But just to kind of show you around the practice a little bit. So everything is on the ground floor. It's full disabled access, and so the practice has 2 surgeries. The first one, switch on the lights. This is surgery 1. You may have dental treatment in here, but this is often where the hygienist works. And we've got digital x-ray machine and digital x-rays in both of the surgeries. So you'll be able to view your x-rays and treatment on the screen. We've got intraoral cameras in both surgeries. So we've got all the kit, pretty much state-of-the-art equipment and instrumentation. Central heating, as most places I'm sure, but we tend to like it quite warm in here, especially during the winter. That's quite nice as well. Disabled access loo. Proud of the tiles that I chose, but I can't take credit for too much more when it comes to the appearance of the practice. So, and see, these are all the things that modern dental practice have to have: defibrillators and digital X-ray machine. And so what happens is you take the x-rays and you pop them in the machine and they'll come out on the screen straight away. So we've got a bit of a gap between patients at the moment. So this is Janetta, who's our head dental nurse, and she's doing some admin at the moment. Lots of things behind the scenes, which one day we'll make a video about, that you have to do in a dental practice just to make sure that you're fully compliant with everything. And I'll just take you through here. And so before we come to the decontamination room, just a stock room. We keep all the stock that we don't keep out in reception here, as well as things like patient study models. And this is a decontamination room. It used to be that all the decontamination procedures occurred in the surgeries, but these days it was made quite clear that a separate room was required for these things. So we have that's an ultrasonic bath, that is a washer disinfector, and these are 2 autoclaves. All sorts of things in here that you need to be compliant. That's a magnifying glass, by the way. All these things need to be stored, so every time a patient gets seen, obviously instruments are cleaned and sterilized, and a log is made of all the instruments that have been cleaned and sterilized so that we can keep track of these things. So that is our practice. We'll just take you back. So it's myself, Glafkos Tombolis, and my wife, Claudia Tombolis, who are the general dentists at the practice. And then we have our head nurse, Janetta, and Catherine is our practice manager. Svetlana is our nurse who works at the practice as well. Claudia does a lot of Invisalign and Invisaligner and removable appliance therapy. And then we have various specialists who work at the practice. They are Dr. Steve Bassi, who is the periodontist, and he also places our implants. Dr. Priti Acharya, who is our orthodontist. Dr. Federico Foschi, who is our endodontist. And Dr. Ivona Shishko, who is our oral surgeon. And they come to the practice maybe once or twice a month. So myself and my wife would be the ones in charge of the everyday tasks of taking care of patients, looking after our patients. And if there's anything that we can't deal with or can't handle, we would be referring to our specialists. So we've got everything under one roof. Okay, thank you.